and use good science to find good answers.
Well, that was from a WHO news conference a little earlier. With me is Cokie van der Velde from the charity Médecins, Sans Frontières. She's just returned from Liberia, which has recorded more than 250 cases of the virus. Also with me, Dr. Annette Reid from the Department of Social Science, Health and Medicine at King's College in London. Good afternoon to you both. Thank you very much for coming in. Cokie, give us a sense of what you saw in Liberia.
I went out to Liberia at the beginning of July, and at that point there was only about 4 or 5 people in the treatment centre. When I left at the end of July, the treatment centre was overflowing with patients. There wasn't enough beds for them, and there was actually dead bodies in the street when I drove to the airport.
And since then, clearly
it's got even worse, yes.
And that is replicated in neighbouring countries to some extent, we are told.
Yes.
Guinea, Sierra Leone, most obviously.
Yes.
Annette Reid, talk us through the decision-making process whereby the WHO has said, in certain circumstances, this untested drug can be used.
So the WHO convened the Committee of International Experts from around the world in order to discuss this really difficult ethical question of whether or not to give access. And I think what went into their deliberations, and which is why I also welcome this decision that they made, is that at the moment we have a situation where there's a disease with a high mortality rate and no treatments available and no preventive measures available. And in that situation, it seems ethically justified to assume higher risks for patients and therefore make these interventions available. In addition, what I think went into their deliberations is that there's been actually a lot of signals from the region saying that they want to have patients, give patients access to these treatments. So for example, the Liberian government has reached out to the US, the Nigerian National Ethics Committee has issued a statement in that respect.
How widely available? I mean, how do people decide who gets this drug and who doesn't?
So one of the criteria that the WHO has laid out, and I think rightly so, is that there needs to be some sort of data collection. So that's one of the criteria. In terms of who should actually have access to it, that's the tricky question where you don't see what they will be recommending. A lot of people have argued at this point that the access should be given to health workers, and I think there are a number of reasons to support that, such as reciprocity. These people have put themselves at risk, such as the idea that they might be able to work and treat patients further down the line, and given that they are trained medically, they might also be better able to give consent. But you could, of course, question if you have a health worker and an innocent child, for example, is that really the right decision to make? I think that's the really tricky question, where what they also said, transparency about how the criteria were reached and how they are being applied will be really crucial.
Cokie, what's your reaction to this decision?
I think anything which helps the patients and is beneficial to them is a very good idea, but of course there has to be a proper medical trial in a proper framework, and the results of which need to be made transparent. But even if this does prove to be a very effective drug, it's not the whole story. We need good community education and mobilisation. People need to be able to alert that they have the disease. We need good contact tracing. There's so much more to this than just an effective drug, and we need more people on the ground doing this work.
Which you would acknowledge, of course.
Absolutely. I actually think, to some extent, even though this is a really interesting issue about access to experimental treatments, it's sort of a sideshow. What is much more important in terms of saving lives are all the measures that Cokie just mentioned, which in part has to do with the fact that there isn't that much of the experimental intervention out there. There's a real problem in terms of the logistics of producing enough interventions, even for those limited trials that are now being conducted.
Because the immediate needs are presumably things as fundamental as clean water and sanitation, and making sure that everything that is there by way of the limited infrastructure can function as effectively as it can.
Yes, and we need training of healthcare workers, we need training of burial teams, bodies need to be picked up from the streets, and until that's under control, this drug, even if it's very effective, isn't going to make that much difference.
And Annette, to take us forward, I mean, we know where we are in terms of the scale of this now. What are your hopes on the one hand and your fears on the other?
Well, the hope would be that production can be scaled up. I think at the moment, really, we're more talking about the low kind of twofold numbers of actual interventions that are there, and that we can gather data and become more assured that the drugs are actually working. We heard a couple of hours ago that the Spanish priest who received the experimental intervention sadly passed away. So there is a lot of uncertainty as to whether this drug actually is doing any good and at which point, in what dosage, etc. So we really need to make small steps, and then hopefully we can scale up as we go along, and then conduct proper clinical trials later on. I think that's really important for future crises. And lastly, if I may say, it's really important then that once there is sufficient evidence that adequate prices are also being negotiated at an international level, because this is a very complex drug that's very costly. Ebola is a disease that only strikes in poor areas, and in order to get access you need fair prices.
Thank you both very much for coming in. Cokie van der Velde and Dr. Annette, thank you both.
Thank you. Thank you.
And just a reminder, if you want to know more about the Ebola outbreak,